Hi, class and professor. My name is Florence Pittman, and I want to give you some important facts about strokes in 2023. I will be talking about the definition, the types of stroke, sys- symptoms and causes, risk factors, diagnosis and treatment, complications, and the prevention of stroke. The definition of a stroke is damage to the brain that occurs when a blood vessel in the brain bursts or is blocked by a blood clot. Without blood, the oxygen it carries, part of the brain starts to die. The part of the body controlled by the damaged area of the brain cannot work properly. Brain damage can start within minutes of a stroke, but quick treatment can help limit the damage and increase the chance of full recovery. This is what your brain looks like when having a stroke from the inside. I thought the picture was kind of cool. There are two different types of stroke. One is an ischemic stroke, which is an artery that is blocked by a blood clot in the brain. And 85% of strokes are this type. Hemorrhagic stroke. This is when the blood vessel leaks or bursts and the blood spills into the brain tissue surrounding the brain, causing swelling. This graph shows some statistical information from countries around the world between the years of the late 89 to 2010. And the significance for this slide I felt was to show how in France they have a low instance in 1985 and it went up a little, but compared to the US in 1993, in 2005, it went up significantly amongst African Americans. This is due to non-modifiable factors, which we cannot change about ourselves, and modifiable risk factors that we can change. The symptoms of a stroke. Even though most people don't know the signs and symptoms, It's an easy way to remember this by the acronym B FAST. B is for balance. The person could have loss or balance or trouble walking. E is for eyes. They might be having trouble seeing out of one or both eyes. F is for face, weakness or drooping on one side of the face. A for arm, weakness or numbness in the arm or leg. S for speech, trouble speaking and responding to simple questions. And T, time to call 911. This is a short video that reiterates what the previous slide showed about Be Fast. Take a look.
You already know that staying in shape is one of the best ways to keep your body healthy. But did you know that goes for your brain too? The healthier you are, the less likely you are to have a stroke. Contrary to popular belief, strokes don't just happen to the elderly. They could occur in just about any of us, although some of us are obviously more susceptible than others. So, who is more susceptible? Well, it really all comes down to risk factors. Now, some risk factors are just a part of life. They are part of what makes you you, and you can't do a darn thing about them. We're talking about your age, your gender, good old family history, untreated heart disease or atrial fibrillation. That's irregular heartbeat for those of us without a medical degree. But there are plenty of risk factors that you do have some control over. I'm sure you know most of these already. But humor me. I'll promise to make it quick. Stop smoking, moderate alcohol consumption, control your blood pressure, lower and manage your cholesterol, stay physically active, improve your diet, control your blood sugar levels if you have diabetes. Right. So now we understand who's at risk. But equally important is learning the signs of a stroke so you can take action immediately. Be fast. Yup, it's an acronym. Let me spell it out for you. B equals balance. Is there a sudden loss of balance? E for eyes. Is there a sudden loss of vision in one or both eyes? F equals face. Does the person's face look uneven? A for arm. Does one arm drift down? Ask the person to raise both arms. S for speech. Does their speech sound strange? Ask them to repeat a phrase. And T for time. There you go. You knew that one was coming, didn't you? Every second, brain cells die during a stroke. Time is brain. So, what do you do at the first sign of someone having a stroke? You dial 911. There is no time to waste. So remember, at first signs of stroke, be fast.
Some other symptoms that can be experienced is sudden confusion, trouble understanding and responding to simple commands, fainting, a seizure, or a sudden severe headache. Causes of a stroke. It depends on what type of stroke you have experienced. A blockage is called ischemic stroke. Active bleeding in or around the brain is called a hemorrhagic stroke. Risk factors, there are two categories of risk factors. One is a non-modifiable and the other is modifiable. Non-modifiable are things we cannot change, like our age, our race, our gender, and family history of stroke, and even genetics. Modifiable things we can change within our lifestyles, like high blood pressure, high cholesterol, cigarette smoking, diabetes, obstructive sleep apnea, lack of exercise, obesity, alcohol usage, drug use, and some types of heart disease. Diagnoses are diagnosed in these hospital procedures: physical exams, blood tests, CT scans, MRI, carotid ultrasound, cerebral angiograms, and echocardiograms. The treatments for these types of stroke depend on which type you have. Ischemic stroke, there is emergency IV to break up a clot given 4.5 hours from when symptoms started. Emergency endovascular procedures, which delivers medication directly to the brain and removing the clot with a stent retriever. A carotid endarterectomy, removal of clot blocking carotid arteries. Angioplasty and stents, which open up a narrow or clog artery to allow blood to flow. Hemorrhagic stroke treatment, emergency treatment focus on controlling the bleeding and reducing the pressure in the brain by excessive fluid. Emergency medication to lower the blood pressure and intracranial pressure. Surgery, endovascular embolization. They insert a catheter with coils at the end to help make the blood clot to stop the bleeding. And SAMV removal, which removes a malformed connection of the veins or arteries. Stereotactic radiosurgery, where they use radiation to treat abnormalities in the brain. Complications depends on what part of the brain was affected and how much the stroke damage the stroke caused. You can have loss of movement in the limbs and loss of senses, speech and language, memory and thinking, perception and emotions. Prevention, the key to prevention is to keep your modifiable factors under control. Manage health problems that raise your risk, such as arterial fibrillation, diabetes, high blood pressure, and high cholesterol. Avoid heavy alcohol use. Lose weight. Get plenty of exercise and stay active. And lastly, adapt more of a healthy diet, make healthier choices, limit your sodium and sugar intake. I thought this was a cool picture of a brain. My favorite color is blue. This is a video of a synopsis of what my slides talk about. So take a look and see if you can follow.
A stroke occurs when the blood supply to a certain part of the brain is reduced or interrupted. Without oxygen and nutrients from the blood, brain cells cannot function properly and eventually die. There are two major types of strokes: ischemic stroke caused by a blocked artery and hemorrhagic stroke caused by a ruptured artery. Ischemic stroke happens when a blood clot obstructs an artery. In some patients, the clot forms locally inside the blood vessels that supply the brain. This occurs when fatty deposits in an artery or cholesterol plaques rupture and trigger blood clotting. In other cases, a clot may travel to the brain from elsewhere in the body. Most commonly, this happens in patients with atrial fibrillation, a heart condition in which the heart does not pump properly. Blood stagnates in its chambers, and this facilitates blood clotting. The clots may then pass into the bloodstream, get stuck in smaller arteries of the brain, and block them. Hemorrhagic stroke, on the other hand, occurs when an artery leaks or ruptures. This can result from high blood pressure, overuse of blood thinners, anticoagulant drugs, or abnormal formations of blood vessels, such as aneurysms and AVMs. As a hemorrhage takes place, brain tissues located beyond the site of bleeding are deprived of blood supply. Bleeding also induces contraction of blood vessels, narrowing them and thus further limiting blood flow. Stroke symptoms may include one or more of the following: paralysis of muscles of the face, arms, or legs, inability to smile, raise an arm, or difficulty walking, slurred speech or inability to understand simple speech, sudden and severe headache, vomiting, dizziness, or reduced consciousness. Cerebral stroke is a medical emergency and requires immediate attention. It is essential to determine if a stroke is ischemic or hemorrhagic before attempting treatment. This is because certain drugs used for treatment of ischemic stroke, such as blood thinners, may critically aggravate bleeding in hemorrhagic strokes. For ischemic strokes, emergency treatment aims to restore blood flow by removing blood clots. Medications such as aspirin and tissue plasminogen activator, TPA, are usually the first options. TPA may be given intravenously, or in the case the symptoms have advanced, delivered directly to the brain via a catheter inserted through an artery at the groin. Blood clots may also be removed mechanically by a special device delivered through a catheter. Emergency treatment for hemorrhagic strokes, on the other hand, aims to stop bleeding, reduce blood pressure, and prevent vasospasm and seizures. These goals are usually achieved by a variety of drugs. If the bleeding is significant, surgery may be required to drain the blood and reduce intracranial pressure. Preventative treatments for strokes include removal of cholesterol plaques in carotid arteries that supply the brain, widening of narrowed carotid arteries with a balloon and sometimes a stent. This is usually done with a catheter inserted at the groin. Various procedures to prevent rupturing of brain aneurysms, such as clipping and embolization, removal or embolization of vascular malformations, bypassing the problematic artery. Thank you for watching. Please feel free to suggest a topic you want us to cover by leaving a comment below.
Remembering BFAST in the event of the stroke got me the proper treatment for the ischemic stroke I had on October 11, 2023. My loved ones noticed that I had loss of balance and could not speak or respond to them, but my eyes were completely open. To be transparent, I wasn't taught these warning signs when I had my first stroke in 2016 and ended up having a second one in 2023 of this year. So please take heed to your loved ones because it can be a matter of life or death. These are my references. Thank you for listening and looking at my presentation. I can truly say I am a survivor. I stood strong, I fought hard, and I won because I am still here and graduating in December. Thank you.